Hi, this is Dr. Ahtsham, and today's videos is about prescription writing. So starting from some basic rules about the prescription writing. So the first one is that the drug name, you always write the generic name. You always write the generic name, okay, and not the pharmaceutical name or the trade name. Then the drug name, the second one is the drug name, your name as well as the patient name and the routes. You all write them in bold letters. No small letters in patient's name or in the drug name or in the roots. Write big letters, bold letters, okay? Then how you going to write grams? It's like G, what is exactly given over here. Milligram, you can write like mg. But for the microgram, you need to write as a whole, okay? Microgram. You cannot write like U and G. It is wrong. Okay, never try this thing. Then comes the units. Same rules imply to the unit as well. When you are writing, you cannot write like a big U, what we commonly write like 9 units. No, you need to write units as a whole. Okay. Then comes inhalational, INH. You cannot write it in a small letter. Inhalational, IH. Then there are the terms like nocte and mane. Nocte means at night, mane means in the morning. If it's given the prescription that is taking some tablets, nocte or mane, that means in the morning and in the evening, respectively. And the PRN as needed. Now, let me show you exactly how a prescription forms looks like. So it has this first page, okay. Here you can see that there are the patient details, okay. Here are again the patient details as well as the date and weight and height and certain other things. This is about the hospital number, address and date of birth. This is weight, height, consultant name, ward, and the hospital. Okay, this is more about the hospital and a few things about the patient. Then here, what allergy to, if the patient is now having some kind of allergy to any drug and what kind of allergic reaction he is having, it's over here. Okay, then name of the doctor. Okay, then it's the signature. You're going to write it over here and the date. Now it's once only page. Okay, that is about the oxygen section. Okay, let me take you through this prescription form and then we are really going into the detail. So this is the first page. The second one is for the antibiotics, you can see. Okay, now the third one is about the regular medications, and the first portion here is about this one is about the anticoagulation. This one, okay, this is the third page, and again you can see over here that it is again similar to the very first page where there is hospital number, name, address, and a consultant, and all sort of details over here. Okay, so this is the third page. Okay, now coming to the fourth page, this is again the regular medication. So first one was about the once only and the oxygen. Second was about the antibiotics. Third and fourth pages are about the regular medications. And then the fifth one is about the as required medications. Okay, and then leave this one. This portion of the anticoagulants is now commonly there as far as PLAB exam is concerned. And then there is another page. Let me show it. That is for the intravenous fluids you are giving, and this is how it is actually. Whatever you are giving, either you are giving the normal saline or ringolactate or dextrose line or whatever, you need to put it over here. So this is how a prescription looks like. Now let's start it in the real detail. Okay, real detail about the prescription writing. So this is the first page. You can see this is the first page of yours. Okay, so if you look at here, there are the patient details. So if there is a sticker containing all the information about like hospital number, name and address and date and NHS number, you need to stick that one over here. You need not to write the things by yourself if the sticker is over there. So you need to place the sticker over here. Okay, it's a sticky one. So you can place it over here. Okay, you can stick it over here. If it's not, then you need to write it. Hospital number, it will be given to you. Name, address, date of birth, and an HS number. Okay, that is about the patients. Now, if you come to this portion, okay, this is about the ward. You need to write it, okay, in bold letters. Okay, hospital name, consultant, and bold letters again. Date of admission, if the weight and height is given, that will be over here. And date, you need to write the date. Chart 1 of 1, and you need to rewrite the date. This is how you're going to fill this one exactly. Now, if you come over here, so this is about the allergy. So you need to write the name of the drug in bold letters. Okay, say for example, allergic or sensitive to, say for example, penicillin. You need to write it in bold letters. Okay, as a whole, penicillin. Okay, now here you need to write what type of reaction it is. Say for example, it's rash. So write it in bold letters over here. It's rash. Okay, or anaphylaxis or whatever it is. So that is about the drug, and here it is about what type of reaction it was. Now, coming here, you need to write your name. This is doctor's name, by the way. Okay, doctor's name. This is the doctor's name. You need to write your name. Okay, and when you are writing the doctor's name, okay, write it in bold letters. Okay, and then here will be your signature. Yeah, here you need to write your name over here, your signatures over here, and then date, today's date over here. Okay, so this is how you're going to fill that one. If I'm going to summarize this thing for you, here you need to put the details. If there's a sticker containing all the information, then you need to place it over here. It's a sticker, so you can place it over here. And these informations you need to write it. By the way, you use a black pen for writing the prescription. No other ink is allowed. No blue, no green, no red. Just black one. So here's the ward name, consultant, weight, height, each and everything. Here you need to write the drug which he is allergic to, the patient is allergic to, in bold letters, and what type of reaction in bold letters. Then it comes your name. You need to write your name over here, your signature as well. Okay, and here is today's date. Okay. Now, really going into the portion where the medication portion is concerned. So you can see it's a once only medication or pre-medication. Okay. So date registered, you need to write the date over here. Okay, what's the date? Like today's date you need to write. Then time required, whenever you want to give this to the patient. Then what is the drug? Okay, let me take it to you, a pre-filled. Okay, come here. Okay, you can see it now. It will be easy for you to understand over here. Okay, so let's check it, what we have already agreed on. So if there is a sticker, you need to put a sticker over here, and you need not to write this thing. And this, you're going to fill it like this. So amoxicillin, you have seen, rash, doctor's name, signature, and the date. Now, today's date, what's the time? Whatever medication you want to give the patient, you need to write this name over here. Then what is the route? IV, per oral, whatever it is, in bold letters. What is the dose? 100 mg, exactly written like milligrams. If it's micrograms or something, you need to write microgram as a whole. And this is your signature and your PLAB number. It's a 3 numeric number, PLAB, that will be given to you. Okay, so this is how you write the once only medication. It's pretty simple. It's very simple. Okay, now comes the oxygen portion. Okay, now in the oxygen portion, you need to tick, first of all, okay, like whatever you want to give to the patient, 94 to 98%, okay, on 88 to 92%. That is in the COPD patients, by the way. And starting device, if it's a nasal cannula or a face mask, or say for example it's non-rebreathing, you need to write in bold letters. Okay, and you want to give as a PRN, that is as required or continuous. You need to tick that one. You need to sign, okay, and you need to write your name. Now there's a problem, like most of the doctors, they have like name which are quite long, so you need not to write your whole name in the UK. Okay, you need to write the last, your last name. Okay, so for example somebody's name is Dr. Peterson Rock, say for example it is, so you need to write like Dr. Rock, and better to write it in bold letter. Here it is written in the small letters. Don't go for the small letters, go for bold letters. Dr. Rock, write your last name only. Okay, last name only. And comes your bleep number, that's the start date and stop date. Now it's morning, midday, evening, and the bedtime. Okay, whenever you want to give it, you need to tick that one. Say for example I want to give it in morning and evening, so you need to tick it over here and tick over here. Okay, and don't put the time. Okay, these the nurses are going to give it according to these are like, say for example there are the regular medications. So the regular medication, they have a specific time. They know that you need to give it at 8 o'clock, and then in the evening at again 8 o'clock. So you need not to write the time over here. Just tick the box, okay, which when you want to give the patient, so morning or the evening or whatever it is. Okay, and here you need to put the date and the month. Say for example today's date is I believe it's a 16, so you write it 16 slash 02. Okay, and then 1702 and so on. Okay, it's a little difficult for me to write it on the screen actually, so this is how you're gonna write it. Okay, so this is about the oxygen. Okay, next we are going to antibiotics. Okay, this is really important. Okay, about the antibiotics. So here you can see what it is. So it is a drug name, a dose, a route, start dose, and there should be a stop dose as well for the antibiotics. And rest of the things are names, your GMC number, your bleep, and what is the indication and additional. Now let's deal it. Okay. So say for example you are going to give somebody a clarithromycin. So you have written a clarithromycin in bold letters. That's great. Okay. So it's a clarithromycin in bold letters. 500 mg, so you have written the dose 500 mg, or it's grams. Say for example so you're going to write like 1 gram. Okay, then what's the route, per oral or IV, whatever you want to give. What is the start and what is the stop date, that is important. Then your signature, your name, your GMC number. Here comes your bleep. Okay, and here is the indication. You need to write the indication, okay, why you are giving this medication. Okay, and then additional information is, say for example BD dose for 7 days, BD dose for 2 days. Okay, or you can write per oral for 3 days. So you need to write some additional information as far as you are giving these antibiotics, because that's why this thing is given over here. Okay, now a few medication antibiotics we initially give them for certain conditions. We give them, this is how you are going to write normally an antibiotic. But say for example there is another case where you need to write need to give antibiotic IV for 2 days and followed by the 3 days of per oral antibiotic. So how you going to write it? Okay, so say for example this was for the 2 days, it was IV, and then followed by 3 days of per oral. Okay, so here there will be the IV, say for example, okay, IV route. Okay, and the rest of the things remain the same. This is how it is exactly. Okay, and I'm giving the clarithromycin. So here I put the date like exactly what I have told you. And now you do not have any morning evening, so now you need to write it. Okay, whenever you want to give this to the patient. So for example, 8 a.m. in the morning, and now you do not write the AM and PM. You write like from 1 to 24, okay, denoting the hours. So 8, and the next one I want to give at 20, okay. If say for example I want to give in a TDS dose, so it will be 8, then the next could be after the 6 hours if I'm going to give the medication, 8 hours, sorry, okay. Then this will be 14, and the next will be 22. So I can write it over 18, okay, here 8, sorry, here 14, okay, and here 22. So this is according to you. You can leave some space, or you can write them exactly like 8 over here, 14 over here, or 22 over here, but you need to leave a space, okay, if you can, so that it's a bit clear, like 8 here, then you can leave one because it's a TDS dose and you have sufficient boxes, so 14 over here or 22 over here. I hope that's clear to you now. Okay, now, so I was giving a clarithromycin IV 500 mg, say for example, for 2 days. Okay, now I don't want to give it on 3, 4th, and 5th. You need to write the exact date over here. Okay, what is today's date, starting from today's date. So this is a pre-filled, so you need not to write it according to that. So it will be over here, it will be 16 over 02, 17 over 02, 18, 19, and 20. Now I want to give for the 16 and 17, okay, for today and tomorrow, say for example. So I need to cut the other boxes. So you can cut them like this. This is totally up to you, whatever you want to choose. You can cut it like this, okay, or you can cut like this. That is totally up to you. So this means that clarithromycin, okay, I was giving IV 500, okay, at 8 and 20, that's BD dose, for 1 and 2, means for 16 and 17, okay, 16 and 17, today and tomorrow. Now for the next 3 days, 18, 19, and 20, I want to give it per oral, so you need to write it separately over here again, okay. How? The same as clarithromycin as a whole, okay, dose 500 mg. I hope I'm making sense. Then now it's per oral, PO. Now start date and stop date, that would be exactly the same. Start date, stop date, okay. Your name and the signature, indication, and additional notes if there are GMC and bleep number. Now what I'm going to do, that it's a per oral. If I have like written it over here that it's per oral, that was IV. So I was giving 2 days IV, okay, and then followed by 3 days per oral. So I'm going to again write the date over here. No, not the date, sorry, the beat time over here, and here is the date. You again have to write exactly the same what's written over here. If I have to write for today's, for example, for today, so it's again I'm going to write it over here like 1602, 1702. Let me fill it so that I can make you understand. 1802, oh, it's hard to write with the pointer. 1902, okay, and 2002. So I was giving this, the first 16 and 17 I was giving the IV. So I have already given the IV. So I'm going to cut this one. Whatever way you are going to cut it, that's totally up to you. And now the nurse is going to understand that yes, okay, 2 days it's IV, and now followed by the 3-day it is per oral. Here. You need not to write anything over here, like I just ticked it to make you understand. But this is how you're going to write it. Now, say for example, with the clarithromycin, you know that the statins are contraindicated. So in addition notes, you can write it like this. Here you can write, okay, 2 days IV. If there's something like that, you can write like 2 days over here, 2 days IV followed by 3 days per oral or something like that. Do not give atorvastatin while on this medication. So you need to write some additional information over here. Okay, so this is as far as your antibiotics are concerned. I hope it's clear to you. Okay, but there are the certain scenarios where you give first you give the IV for some days and then you give the per oral, and then you need to write exactly like this. Okay, you cannot change it over here. You need to write it separately. You need to change the route. You need to put um, the date as it is, and then you need to cut the boxes. Okay, so this is how the simply you're gonna write a antibiotic, and when you need to switch it IV to oral, how you're gonna switch that one. So this is as far as antibiotics are concerned. And as far as antibiotics are concerned, you need to remember the doses in certain scenarios, in certain diseases, as well as if somebody is allergic to some of the antibiotics, what are the other options available? Okay, what are the other options? And then certain other things, like in clarithromycin you cannot give with the atorvastatin, so you need to stop the atorvastatin. Even if it's given in your prescription, you are going to stop that one while the patient is on this clarithromycin. Now next comes the regular medications. Okay, you again see that it is same. Okay, if there's a sticker, just put a sticker over here. You need not to write anything. If that's not, you need to fill it. Then it is similar to your very first page. Okay, so you're gonna fill it like this. Now if you analyze this thing, so there are the regular medications. The first one is for anticoagulants, and then anti-embolic stocking. You need not to much to do in a PLAB 2 exam with this thing. And then comes the regular medications. Okay, so if it's about the anticoagulants, you're going to write it whatever you're going to give. Okay, like it's deltaprin. Okay, this is for the deltaprin. You cannot write anything else if it's already written over there, deltaprin. Okay, you cannot give the unfraction heparin by cutting that down. There will be the deltaprin. If there's a deltaprin, you need to write it over here. So 5,000 units as a whole. Okay, subcut. Okay, this is a start date and name and your last name and PLEP number and additional information if it's over there. And this is a prophylactic dose, and that's given in the evening. So it's ticked over here. And any of the days, if you don't want to give that one, you need to cross those. Say for example, you don't want to give it on say it was a January, you don't want to give it in 4th and 5th January, say for example, presuming, so you need to cut that one. So anybody can understand, yeah, okay, you have to give, because nurse will be filling this form and ticking it every day. And now he got, okay, at the 4 it's already cut, 5, this means that okay, we need not to give this medication on the 4th or 5th. This is how, if you have to omit the medication on any of the days, okay, you need to cut it like this. Okay, you just need to cross that one. As you have already ticked this one over here, so nurse is going to understand that this medication is only meant for like evening. Okay, so I have to give the evening doses, and in the 4th and 5th I'm not going to give that one because that was cut. Okay, so that's for the deltaprin. Now coming to the other regular medications. Okay, say for example levothyroxine. Come over here. Levothyroxine, this is for a regular medication. I have written it as a whole. So 100, you see that the micrograms, it's written as a whole. Milligram, you can write it as mg, but the microgram as a whole. So what is the route per oral? What is start dose? And for the regular medications, there is no stop dose. Okay, so you have left it like this. Again, same, the sign and the name and any additional information. If you want to write it over here, you need to write it. Okay, once daily. If there's nothing, you can write it even once daily. Okay, or any of the additional informations, you need to write it over here. And now again you have to tick it only over here. Okay, that you want to give it in the morning, evening, or the morning, or in the evening, or morning, or the bedtime. You need to tick the corresponding box. Okay, so in the above you need to write the date and the month. Okay, and it's gonna go like this. Today will be like 1602 17 18 19. You need to fill that up to here. Okay, the first thing when you come to this page, after filling these the things which are above, is to fill the date. Okay, now for like tiotropium bromide, if it's over here, now it's 2 puffs, INH inhalational. Start date, there's no stop date, and whenever you're gonna give, you need to tick it in the subsequent, okay, in front of the subsequent box, in the morning or the evening or whatever you want to, whenever you want to give the patient. Now if you have to stop some medication, say for example, okay, you stop the medication like this, exactly what it is. Okay, and you need to sign, write your name and your GMC number. Okay, and you stop it like this. This is how you exactly stop. So this is again for a regular medication. Say for example, some was on apixaban for atrial fibrillation or for DVT or whatever. So apixaban, right, like this, 10 mg. You have clearly written per oral. This is a start date. Okay, and there could be a stop date in a regular medication as well. Where, say for example, you are giving for the DVT, so somebody is over there, so for the 7 days you give the apixaban 5 mg BD. Okay, and then for the next like 3 months, another 3 months, 2 months, and 23 days, you give them a 2.5 PD. Okay, this is how you give 10 mg BD. Now apixaban, it's for the DVT. If you are giving to somebody the apixaban, then initially have to give that one as a 10 mg BD, and then it's for the 7 days, and then it's just 5 mg BD for the next 2 months and 27 days. So this is as far as your regular medications are concerned. Okay, so now this portion is about the as required medications. So this is a very simple thing. Okay, if you look at this thing, so you need to write the medication name. Now here is the indication why you are giving this as required, then dose, then route, subcut. Okay, frequency, here this is a new thing. So frequency, 4 hourly, 6 hourly, okay, whatever you want to give, and you need to write a maximum dose per day. Okay, and here you need not write anything. So she is gonna give you, like the nurse is gonna give it according to your instructions over here. Okay, 2.5 mg, subcut, it's 4 hourly, and maximum dose she needs to give is like 20 mg. And additional information, it's again the additional information over here as well. If there's any additional information, you need to write it. Now again, cyclozines for vomiting, 50 mg, subcut, frequency, okay, 8 hourly, 12 hourly, whatever, 150 mg, and additional information. And this is how you, this portion is the simplest one, because you need not to write any date, you need not to write any time or date or whatever. This is not related to you. You need to write, um, you need to fill this portion only. Okay, now comes your infusion part. Now if you see it, look at this thing. Okay, so consultant, here comes consultant, surname, first name. These are all the indication allergies if there is. So it's simple. You put the date, you write the type and strength, 0.9% normal saline or ringer lactate. You need to write it exactly. You cannot write like normal saline or oral or no abbreviations like this. What is the volume? You need to exactly write 1 liter or 500 ml. So you need to write it ml. You can write it like this. It's okay. So it's IV. Okay, and what's the duration of it? You're gonna give it over 6 hours or over 12 hours. She's gonna calculate. Okay, and she's gonna give the 1 liter fluid you're gonna give over 6 hours, and that's your nine prescript your signature and your name. That's simple. That's very simple. So this is how you exactly write your prescription. It's not difficult. You need to practice it again and again. Okay, and you need to remember the dosage. That is important. The dosage is important, and then the interactions. Okay, the interactions are important because what I mean by interaction is actually it's not the interaction. Sorry, it is if somebody is allergic to some medication like the antibiotics, particularly. So how you need to switch that one, because you will be given those medications over there, and allergy is given. So you need to switch by yourself. Now there is another thing. Okay. Say for example, if you need to give like a methotrexate, you need to give the methotrexate to somebody. Say for example. Okay, so I am going to give the methotrexate to somebody. So say for example, I have written it as a whole. Don't write like mtx, but it's metho as a whole. Okay, so this is the dosage I am giving, like 5 mg. Okay, it's per oral. Okay, this is the start dose. There might not be any stop dose because that's you're going to continue. It's a regular medication. Here is my signature and my name. Okay, and the bleep number. And you know that methotrexate you give once weekly, so I write the additional information once weekly. Okay, so here there will be the date you have already written over here, so I want to give it in the morning. Okay, but it's a once weekly. Say for example, this was 16, 17, 18, 19, 20, 21, 22, 23, 1 2 3 4 5 6 7. Okay, 23. So I want to give it on once weekly, and that comes to be 20. Okay, so it is the 20s. Okay, so I'm going to do it like this, 20, and I'm going to cut the rest of the boxes. So it's gonna get to know that okay, it's a morning I need to give, and I only need to give it, okay, on this was 20, so I need to give it 20 while rest are cut. Okay, that's totally up to you. You can write it like this, whatever is easy for you. The other way of writing it is, once you are giving once weekly medication, is that you have encircled this one and you can cut all of them, the rest of them. That is totally up to you. Well, you need to leave the other things. Okay, you need not to write anything over here. Okay, because you have ticked this one, so the nurse is going to understand that it's a morning dose. Okay, so you not to do anything with rest of the boxes. So this is as far as the once weekly medication is given. This is exactly how you write it. Okay, for regular medication, you put the date over here, and it's okay, it's gonna work for the other boxes here as well. Okay, yeah, yeah, it's gonna work for this one as well, this one, this one, this one. But if you analyze the antibiotics, okay, where are the antibiotics form? Okay, these are the regular medication. Yeah, yes, there is the antibiotics. So you need to put for every antibiotics, you need to put the date over here. If you are writing some antibiotic, you need to put the date here as well. Okay, and here it's already like separately it's given for you. Okay, the other thing is that when there is like in the regular medications, if it's written on morning and evening, it's morning, midday, evening, and bedtime. You need not to write like here like 8 a.m. and 2014 or 16. You just need to tick. Okay, you go want to, because these are the regular medications, and they have certain timings. So nurses know about this thing, that when they need to give it in the morning, there will be a specific time of giving these medications. Okay, let me see if I'm missing anything. Yes, well, I don't think so. Yeah. If somebody's confused about the years, it's the year like 2023. It's okay. That's not a problem. In additional information could be like 2 days of IV are followed by 3 days of per oral, or it could be something like that. Do not give with like clarithromycin. Do not give with do not give the the statins. Okay, do not give the statins. Say for example, I have given the clarithromycin, so in the additional notes I can write like this, that do not give clarithromycin while on do not give the rosustatin or atorvastatin while on clarithromycin. Okay, or it's if I'm giving it for IV, so you can write like IV for 2 days. 2 days. Okay, IV for 2 days. Okay, and here I can write then per oral for 3 days, or you can write like do not prescribe statin. Okay, do not give statin. Do not give the statin. Simple as that. Okay, so this was a lecture about the prescription writing. It's very easy, by the way. It's very easy. It just needs the practice. If you're gonna practice it again and again, and the things are that you need to know the antibiotics. If it's allergic, what you need to give, the dosage of the antibiotics, that is important. These are the two things which are very important, by the way. Okay, how you gonna write those?